Guy Jenkins Bass is a gay man who speaks openly about how he contracted HIV.
I was raped at 18 by someone that I was dating at the time, and they were positive.
He found out he too was positive while trying to donate blood.
The world stopped. I lost all sound. I heard nothing. I pretty much saw nothing.
13 years later, at age 31, Jenkins Bass is married to his partner, has stepkids, and works to educate others about HIV and the importance of immediate and ongoing medical care.
I don't think I've ever been without it.
That statement is one HIV researchers and activists want to hear more. Nearly 20,000 of them will converge on Washington, D.C. next week for the International AIDS Conference, the first time it will be in the U.S. in 22 years. New optimism for treating and preventing the AIDS virus is brewing.
I think we are at a turning point.
In the last 2 years, studies have shown what Dr. Anthony Fauci calls breathtaking results in preventing those at high risk of HIV from getting it. The research, in part, spurred the Obama administration to call for an AIDS-free generation.
We're talking about a significant turning around of the trajectory of the pandemic, where you can actually think in a realistic way that this is a goal that's doable.
The big new focus is treatment as prevention, getting infected people medical care as soon as possible. The healthier they are, the less likely the virus will spread.
My HIV med.
Justin Goforth has lived with HIV for 20 years and works at a health clinic. He's carefully followed a daily pill regimen since life-saving drugs came out in the mid-1990s. Early on, it was a brutal grind.
The pill burden was amazing. I took over 40 pills a day.
Advancements have since lowered his burden to 5 pills a day, and many new HIV patients now need just 1 pill.
So it's a really different world for me in treatment compared to where I was.
But even 1 pill a day is a tall order when 34 million people worldwide are HIV positive, and many don't know it. Of the 1.2 million infected Americans, the government estimates 1 in 5 are unaware. There are still 50,000 new infections here each year. Fauci says the demographics of the epidemic changed since it started in the mid-'80s. Most new cases are still among gay and bisexual men, but African Americans as a whole now account for 44% of new infections.
That's the group that we have failed to seek out aggressively enough, to test voluntarily, to convince them to get tested.
He says classic prevention methods are still vitally important: condom distribution, general HIV education, and testing.
So you know about the HIV and AIDS epidemic in D.C.?
These efforts are underway in the nation's HIV hotspots, like some low-income minority neighborhoods in D.C., where the new infection rate rivals that of some developing countries.
Do you think it's important to get tested for HIV?
The community education group sets out each day in a mobile testing van to perform 20-minute swab screenings on residents.
I pray to God very positive.
Anyone who does come up positive on the spot is brought to a clinic and put into a long-term care program like those that helped Goforth and Jenkins Bass. A few miles away, the AIDS 2012 conference will work to spread the latest testing and treatment methods around the world. Finding the money and know-how is the next major hurdle in perhaps one day having an AIDS-free generation. Carlotta Bradley, The Associated Press.